Nowadays patients have a very stressful lifestyle. They have that sedentary lifestyle. They're just going to work, no exercise, no balanced diet. So all these factors have definitely come in, which are affecting the fertility rates, and the fertility rates have drastically going down nowadays.
Fertility rate is declining.
Overall total fertility rate
has drastically declined here in India.
People just feel that it is the female side who is responsible for infertility, which is a big myth, because it's not like that.
Meet Dr. Mandavi Rai, a leading gynecologist. She's a senior fertility and IVF specialist based in Noida. After completing her MBBS and MS in obstetrics and gynecology in Mumbai, she advanced her expertise with a reproductive medicine fellowship at the National University of Singapore and a postgraduate diploma in reproductive medicine and sexual health from the University of South Wales, UK. With over 3,000 successful IVF cycles, a remarkable 90% success rate, Dr. Rai has built her practice on empathy, cutting-edge technology, and personalized solutions. Renowned for her ability to truly walk in her patient's shoes, Dr. Rai brings warmth, clarity, and trust to every step of the fertility journey, making dreams of parenthood a reality, one success story at a time.
See, a male partner's sperms is a very important part. It is a shared journey between female and male partner. We cannot really say it's just the female partner who is responsible. Even the male partner's sperm quality, we need to see what type of sperms we are taking for IVF. And there's one more myth which I have seen with IVF. People feel that if they're undergoing IVF, that means it's not their own child. It's not like that. It's never like that, because we're using your own eggs and sperms. So it's not that if we're doing IVF, it is done something from outside. It's not like that. People always come and tell us, ma'am, IVF हो रहा है तो I think हमारा twins ही होगा. So that is not right. You can have twins, definitely. The chances is 30 to 35%, but not necessary that you will have twins. Now I feel people are more aware. People are more accepting the fact, especially the younger generation. But still we need to, talk more about it, even on social media, TV, so that it becomes acceptable for patients.
Dr. Mandvi, thank you so much for taking time out for this podcast. I really appreciate your time. And before starting this podcast formally, I request you if you can share some more details about yourself for our audience regarding your professional and personal journey.
Thank you so much for inviting me. So I'm working as a fertility consultant at Motherhood Hospital, Noida. Plus, I have my own OPD, Divine Women and IVF Clinic in Noida only.
Right. And ma'am, when and why you have decided to pursue your higher education and full-time career in reproductive medicine, and to be precise with respect to IVF?
See, right from my MBBS days, reproductive health and fertility, always, I had that attraction towards it. Because when I used to see these infertile couples being, so stressful it used to be for them. And so I always knew that I wanted to be part of their journey where they are able to achieve their parenthood. So that really inspired me, because, that fertility journey is it's a big roller coaster for any couple. So being a part of it, being with them in their darkest time, and then seeing them smile, taking home their babies, it's a very nice feeling, which really cannot be explained.
And nowadays, infertility both in men and women is increasing drastically. So in your experience in last 4, 5, 10 years, what drastic shift you have seen, and what are the major reasons behind such kind of infertility increasement?
See, in last 4 to 5 years, definitely it has increased. Plus, awareness has also increased in patients. And nowadays, patients have a very, stressful lifestyle. They have that sedentary lifestyle. They're just going to work, no exercise, no balanced diet. People are thinking for marriage, that too also in a later ages when they are, I think, financially stable. And couples are also thinking for kids at a point when they feel that now I'm financially stable. So all these factors have definitely come in, which are affecting the fertility rates. And the fertility rates have drastically going down nowadays.
And recently I have seen one of your article related to increasing infertility in Gen Zs and millennials. Can you share some more details?
See, nowadays what we are seeing when patients are coming to us, we are seeing a lower side of AMH. Even the count of their eggs are quite decreasing. Maybe because they are coming at a later stage. Most of the females who are coming to us are coming after the age of 35. And yes, there's a lot of decrease in it. Maybe because of the stress, maybe because of lifestyle people are taking. There is no, exercise, yoga in daily routine of people. They feel like, now I'm trying for fertility, let me start with yoga and everything will be fine. It's not like that. It takes a long time for these results to happen. So I feel yes, it has definitely increased, and in females especially, I'm seeing a decline in AMH levels, which is an anti-Mullerian hormone, which is a test for seeing your reserve of eggs. It is decreasing.
And for our audience knowledge enhancement, can you simplify male and female infertility?
Yeah. So, differentiating between male and female partner. One more thing I'd like to say is that, people just feel that it is the female side who is responsible for infertility, which is a big, big myth, because it's not like that. Both the partners are involved in it. Sometimes we see the cause can be in males, sometimes it can be in females. So, coming to specific reasons in females, we can go step by step. First is the ovaries, where we can see hormonal imbalance as in PCOD. Then we can see decreased AFC count, which is the number of eggs. Coming to that, we can also see cyst in the ovaries. Other than that, tubes, where the tubes are also affected, where you have hydrosalpinx in the tubes are blocked, where pregnancy cannot happen. Other than that, in uterus also there can be problems. There can be adenomyosis, fibroid. Sometimes we had patients where the lining of the uterus also we are not able to make. We cannot get an adequate lining. Coming to male side, the problem can be anywhere. It can be pre-testicular, testicular, and post-testicular levels. So coming to that, we can see the sperm parameters are definitely affected, where count, motility, and morphology is quite deranged. Other than that, there can be hormonal imbalance also. We do have cases of azoospermia, where we do not see any sperm in the semen. So that, there can be also different causes for it. So all these causes needs a proper investigation and treatment planned according to that.
Correct. And as and when any couple or any individual comes to you and they wants to go for IVF, what kind of like medical test procedures you perform just to make sure that if they are eligible for IVF, or if there is any chance of natural pregnancy?
So when a couple comes to us, we definitely tell them about some pre-tests, like blood investigations. For females, we do ultrasound, and for males, we see the semen parameters. Depending on that, we will see what can be done. See, IVF is not the only procedure which can be done. Yes, there are other procedures like IUI, natural trial, which we do give to patients before we think for IVF.
And there must be multiple cases wherein maybe there is some medical issue with respect to male counterpart or female. In such cases, I'm sure it will be like a very counseling session for you just to convince both the parties that you have to go through IVF or artificial insemination or any other process. So how do you deal with these situations? Because it's like a very emotional decision, and sometimes very difficult to make other party understand about the complexity of situation.
See, when a couple comes to us, I think in fertility, counseling is the toughest part which we have. Convincing a couple that you have to undergo procedure, you have a problem, is a very difficult part. And so over here, counseling, therapies do help them a lot. And sometimes patient does understand, and sometimes they will not. So when I am telling them something right, they might change. They'll think this doctor is not giving me the right opinion. So, or I am not ready for IVF, but she is telling me IVF or whatever procedures. So they tend to change also. They'll go to some other doctor for second opinion, third opinion. So somewhere I feel the counseling should be given the most weightage. During IVF, before IVF, and the most important part is post IVF when the failure happens. That part is the most important part, where you need to give counseling to a patient. You need to be with them. You just cannot say that I have done IVF, now it has failed, now it's your luck. You cannot. You have to talk to patients. You have to listen to them, because during the IVF procedure, they are physically, emotionally, and financially they are drained. So counseling plays a big, big role in it.
I completely relate to this fact, and I also believe it's most important part, because it's not only like monetary terms, it's a very physical and mentally draining process, wherein if there are multiple failures in the process,
True.
and you have to trust on yourself and the physician you are dealing with.
Right.
So counseling really plays a good, very great part. And just to understand IVF in a layman's term, because for general public, IVF is like test tube baby, right? But I really like to understand as a medico, if you want to explain to general public what exactly is IVF in simplified terms.
So see, IVF, as I said, we'll do some pre-tests for you to decide if you have to go for IVF. If you have to go for IVF, then we do call you on second day of your cycle. Then we'll start you on hormonal injections, and that injection might go for around 10 to 12 days. Post that, we do egg retrieval, or what we call as ovum pickup. We see for the maturity of eggs. We'll take sperms, we will infuse the sperms in the eggs, and once the fertilization has occurred and day 5 embryos are formed, we will tell the patient that how many embryos are formed and how many we are freezing. Once the embryos are formed, now we will act on your uterus. We will prepare your lining, and once the lining is prepared, we will transfer those embryos into your uterus. Embryos can be anything day 3, day 5, depending on the need of the patient. So this is a simplified IVF process which takes around 2 to 3 months.
And during the entire process, which is the most critical step, wherein as a medico you are really, really cautious that that's the deciding timeline.
See, that is the most important part, is the embryo transfer.
Embryo transfer.
Yes, where we are putting the embryos inside you, and post that the precautions which you have to take. So that is I think the most crucial step. Plus before that, definitely how your embryos are being formed, and if we have a good embryos, then success rate goes good. If we are not, then definitely success rate decreases.
Right. And in your experience while doing this overall process, how important is the quality of sperm in the overall process? And in case if there are multiple failures, what is the next step?
See, a male partner sperms is a very important part. It is a shared journey between female and male partner. We cannot really say it's just the female partner who is responsible. Even the male partner sperm quality, be it the sperm count, sperm motility, or sperm morphology, it plays a very important part. We need to see what type of sperms we are taking for IVF. And definitely a male partner, suppose if we are having any differences in the parameter, we generally go for further tests like DNA fragmentation index, where fragmentation of the sperms or the DNA quality of the sperms are also seen.
Correct. And how helpful is technological advancement in the procedures you guys are performing compared to 10 years back, whatever you guys are doing? I'm sure there are
a lot of changes. 10 years back what we did and now what we are doing has really affected the success rate also. 10 years back the success rate was not that much, but now coming up to the advanced techniques like we have genetic testing, where you said what to do if we have repeated IVF failures. So we go for genetic testing of embryos. We see if the embryos are genetically healthy or not, and then we go ahead for transfers. Other than that, we have laser-assisted hatching, blastocyst. We have time-lapse imaging nowadays, in which we see the growth of the embryos without interfering in them. And other than that, there are also immunological causes for failures, where we can use lit therapy. Then there is ERA technique, which helps us to see what is the condition of the uterus at the time of implantation. Right. So all these techniques are definitely helping patients to get a better result. But still IVF is not 100% even if we do all these tests.
Correct. And how important is, apart from the patient awareness, I know society also needs to be really aware. So basis on your understanding and interaction with patients, their family, where we are right now in terms of the acceptability of IVF, considering the kind of society we are living in right now. So have you seen any evolution change in the pattern of people?
There has been a lot of change than earlier. Now I feel people are more aware, people are more accepting the fact, especially the younger generation. But still we need to, I think we need to talk more about it, even on social media, TV, so that it becomes acceptable for patients. Somehow I feel it is like people don't want to tell that I'm undergoing IVF, maybe because they are feeling that they'll be judged for it. Yes. And and there's one more myth which I've seen with IVF. People feel that if they're undergoing IVF, that means it's not their own child. It's not like that. It's never like that because we're using your own eggs and sperms. So it's not that if we're doing IVF, it is done something from outside. It's not like that. So more awareness is needed. Social media, TV, with more voices actually who people connect to. If they come out and say all these things, it will be a good change,
Right.
especially in the older generation.
And as we see now, more men and women, they are more concerned and plan their careers, and they decide to have kids after a certain point of time. So any advice from your end? Because as we discussed, that quality of a sperm and eggs deteriorate as we grow old. So any advice for anyone who is listening to this podcast?
See, nowadays, what I feel now in females, they are becoming more career oriented.
Mhm.
So I feel they can get their eggs freezed.
Okay.
And not to take that pressure. You will always hear there is something which is as a biological clock.
Mhm.
It is definitely there, but you
Okay.
don't need to pressurize yourself for that. You can definitely get some tests done, like I said, blood test called AMH
Mhm.
and ultrasound for AFC, and then you can accordingly decide what you want to do. You can freeze your eggs because freezing eggs help you in getting a good reproductive potential when you are at younger age and a good quality eggs.
Mhm.
So you can freeze them, focus on your career, and do pregnancy whenever you want to do.
And in terms of like affordability and access of such centers which provide such kind of facility, can you share some more light?
See, nowadays IVF have become quite
Mhm.
affordable uh, because lot of centers have opened,
Mhm.
and these accessibility has also become good because even at remote areas now we are having good IVF centers opened. Plus affordability, which used to be very very costly way back 5 to 6
Mhm.
years, now have become much more affordable. The rates have become much more affordable. Plus, nowadays I'm seeing insurances, corporates covering all these IVF cycles in their packages. So that has become more pocket friendly now for patients.
Right, right. And can we touch upon another related topic, that is surrogacy, and where the IVF is placed in the overall ecosystem?
See, for surrogacy, nowadays rules have really changed.
Mhm.
And earlier, what we used to have autistic surrogacy, they have all stopped. Government has made guidelines. Now, only your relatives can do surrogacy for you. And there are various other guidelines. Many states have not had boards made for them, which has led to a little halt in surrogacy. Not everyone is doing surrogacy right
Mhm.
now. And you have to go through board to get the permission also for surrogacy nowadays. So it has become a little cumbersome. Like earlier, it used to be much easier,
Mhm.
but now a lot of rules have changed regarding surrogacy.
Mhm. And any rule regulation related to any single woman wants to have kids, or same sex couples?
So single women are allowed to have kids with donor sperms, and there are people who are coming for that. Be it single women, being separated women, they can go ahead for IVF.
Mhm.
IVF or IY, anything is okay with them
Mhm.
with donor sperms. Coming to same sex, obviously legal issues are a lot of there. We don't see many couples coming for that as of now
Mhm.
because I don't think India has allowed that. But like, even if they have allowed, the rules are quite
Mhm.
strict
Mhm.
for that. So we don't see same sex as of we don't see that much of same sex right now.
Right.
But single women we are seeing.
Understood. And in terms of like artificial insemination or sperm bank, I'm not really sure and aware about
Hmm.
where we are in terms of technological advancement, or
Hmm.
any banks we have, like we have for
We have
egg freezing. We have.
see egg freezing we do in IVF center.
Okay.
And ART banks are separate. They are government
Mhm.
authorized banks.
Understood.
So ART banks have to apply to government to get the
Mhm.
authorization, and so from there we can get donor sperms.
Mhm.
Coming to donor eggs, the donors have to come from these authorized agencies
Right.
to us
Mhm.
for IVF.
And from last few years, there has been a lot of hype about. Uh, I'm talking about artificial insemination
Hmm.
from sperm banks.
Hmm.
Like there are many couples I have seen in movies. I'm not
Hmm.
really sure if it's happening in real life scenario, wherein uh, couple wants a kid with nose like Hrithik Roshan and, and other phenotypic features like Brad Pitt and all. So is it really possible or happening across the globe, or it's just
See,
a myth?
there are couples who come up with not such fantasies, but
Mhm.
yeah, they are like, we want a fair kid. If they are taking donor, so they do have assumptions कि
Mhm.
मुझे एक fair donor मिले, अच्छी donor मिले, या even for male side कि
Yes.
he should be tall, he should be fair. So these are there in cases of donors. Definitely they are coming up with this. But yes, I think outside India it is more.
Correct, correct. But there is no surety about the success rate of IVF, even if you are getting the phenotypes, but genotypes is a
Yes,
typically
yes,
different
yes,
ballgame.
yes, yes.
Right, right. And any idea, as we talked about egg freezing and all, any ideal age bracket you suggest wherein if someone wants to decide to freeze the egg, what is the right age bracket?
See, the right age is when I can get most of the eggs. But then coming to age criteria, it can be somewhere between 24 to 35. Because after the age of 35, the egg quality and quantity definitely starts decreasing. So if I have it before 35, good enough. If I am not, then just get it freezed whenever you are okay. Because I've had patients where I freeze eggs even at 40 years. So it depends. A female can freeze her eggs at 35 also, and we can get good quality. Freeze at 40 also, we can get good quality.
Understood.
But mostly it is like, do it before 35.
Got it, got it. And any alarming sign in the age of like 20s and 30s wherein women should feel like maybe this is some sort of alarm or indication from body and this is the right time to get your family expanded or do the egg freezing basis on the future goals?
See, basically, if you are having family history of cancer, or you're having mother, sister having menopause at an earlier stage, I think you can definitely go and consult a fertility specialist. And if you are married and it's been more than 1 year, you are less than 35 and you're not able to conceive, consult a fertility specialist. Same things when it is above 35, I'll feel ki you should, if you're trying for 6 months, you're not able to conceive, consult a fertility specialist. It's much better to try under guidance rather than just doing it blindly.
And basis on your overall experience in this field, any anecdote or story you like to share which I would say motivated you and given you a sense of that you are whatever profession you have chosen, you are on the right track. Any story you like to share?
See, as a clinician, we are always growing with all the, as many couples as we come in contact with, definitely we are learning something new in it. Because all of them have a different story, different timeline, and a different timeline to get pregnant also. So we had this couple who had come to me post her laparoscopy surgery. Her tube had hydrosalpinx, meaning the tube was filled with water. She had to go laparoscopy surgery. It could not be done because there was a lot of adhesions in her abdominal area. So she came to me for IVF and she had hydrosalpinx in the tube. So when there is a hydrosalpinx in the tube, it is difficult to conceive. Though we explained her everything, we could not do her surgery. We kept her on antibiotics and we tried her IVF. In first attempt, she failed. She could not conceive. I explained her everything. We said we are taking we'll do next cycle, but hope is a little less. She conceived in the second cycle and she delivered also a baby girl. And the day she delivered, she told me, ki, ma'am, you have given my life back to me. So that is one of the things where, you feel like you are doing something good for the society. You're doing something good for the couple who really wanted a kid and was not able to get it. And we've had so many stories like that. This is just one of the stories I'm sharing where, at the end, when they are holding the baby, coming to your clinic, you feel something that, and when they just say, ki, ma'am, we have no words to tell you. This is a totally different feeling. I don't think we can really express it. But it's a wonderful feeling.
I can completely understand. It's not like sense of achievement, but sense of fulfillment.
Exactly.
Right?
IVF, is not always about success, getting success or not. Sometimes being with them is also good.
Right. The overall journey, emotional roller coaster.
Yes.
And any sort of, we have already talked about some of the misconceptions or any sort of like myths in and around IVF treatment and infertility. Any additional thing you like to add
There are a
upon?
lot of myths. I think IVF is the most misunderstood technique. So first and the foremost myth, as I told you, it is always like female partner is to be blamed. It's not like that. It's a shared journey where the problem can be male also, female also, both can have the problem, and sometimes it is unexplained. Second important myth is people feel that IVF is only for older couple. हम तो young हैं, we don't need IVF. It's not like that. Depending upon your cause, it depends you need IVF or you don't need IVF. Other than that, there's one more very very important myth which people always come and tell us, ma'am, IVF हो रहा है तो I think हमारा twins ही होगा. So that is not right. You can have twins, definitely. The chances is 30 to 35%, but not necessary that you will have twins.
Correct. So, Dr. Mandi, we have talked lots of things about IVF and other procedures, but I like to ask, are there any other techniques or procedures if someone is not willing to go through IVF? Can they still have kids?
See, IVF is not the only procedure. We have other procedures also, like natural trial, ovulation induction, where we will give you medicine, we see for the maturity of eggs, and then we tell you to try naturally. Even if you are not able to conceive with this for around 3 to 6 months, then we will opt for IUI, which is intrauterine insemination. In this also the same thing happens. We'll give you medicines and we'll see for the egg to become mature. Then we'll give you injection for rupture, and then we will take the husband semen sample, wash it, and put inside the female partner. Even after this has failed for around 3 to 4 cycles, then we definitely tell you to go for IVF.
Correct. And in terms of like success ratio, which one is
Yes,
more?
so if we go for success ratio, definitely IVF has a better success rate. IUI does not have that good success rate, but it is around 15 to 20%.
But we have these two options.
Yes, we have these two options. If you know, if IVF is not the only solution, you can try for these two first, then go for IVF.
And in terms of spreading awareness, what measures as a clinician you, your fraternity is taking, and do you feel that whatever government and other organizations are doing, is that enough, or still there is a lot of scope in terms of spreading the awareness in India?
So, you know, I feel in colleges and schools, fertility is the most, it's the topic which is not discussed at all.
Correct.
When you have a fertility part discussed in colleges and
It's like
schools,
a taboo. Nobody.
yeah,
discussed.
it's a taboo. And what they discuss is the menstrual cycle and the contraception. So it is beyond that. Talk about female fertility, talk about male fertility. There's no shame in it. You can talk about it. So if these things are incorporated, I think colleges and schools, definitely, I think there'll be a lot of changes, lot of awareness, and lot of acceptance also. People will have.
And if I like to know more about reproductive medicine and IVF techniques, the kind of specialized field you are in, if any medical professional will watch this podcast later, they like to opt as in their super specialization, what kind of challenges they will face, what kind of mindset they should bring in, and the future prospect in this domain?
See, you know, coming to IVF, I think you should have a lot of patience, and you should know how to be with your patients. It's not always like कि हम IVF कर रहे हैं, IVF किया खत्म हो गया. नहीं. IVF में you have to be there for your patient every time. You just can't think कि this procedure is finished, I am done with it. No. They are with you for a very very long time. Maybe they're with you for 6 months, 1 year. So you have to be very very patient for that. Just आजकल no, it's been like reproductive medicine has become a trend. People want to do, but then there are a lot of patience and counseling involved in it, which you have to learn how to do it, and that will come from experience. Nobody is going to teach you that.
And there has to be a natural sense of empathy,
Yes.
and
You need
like
to have a lot
perseverance
of
and
empathy. Yes.
correct.
You cannot just, because you know that infertile couple is going through a lot of things, emotionally, physically, financially. They are getting drained. So at least you can be with them through their process and have a lot of empathy for them, because that is what you can give them.
You have to have patience to listen to them, and
yes,
not
yes.
always offering a right solution, but at least listen and understand their
That
concern.
is what they want, you know. The couple is not able to discuss things outside. They're not able to discuss with the family. Sometimes I have seen the couples, only female is coming, male partner is not coming. So that female needs a lot of support from you, because she is not getting support from anywhere else.
Absolutely.
Be it home, be it husband, they are not getting it. So you are the only one who is actually supporting her through her journey.
Trusted partners.
Yes.
Right. And in general, any message for our audience, be it a couple who is looking for IVF treatment, or anyone who is battling with infertility, or in general, any message you like to give to our audience, society?
See, for infertility couple who are going through it, I will just like to say that it's a shared journey. It's never just the female, it's never just the male. You cannot don't blame each other. Be in that shared journey with each other. Plus, females who are undergoing IVF, they should understand that every consultation, every ultrasound, every injection which they are taking is an act of courage for them, and they should be kind on themselves. Be don't take stress that I have to get this pregnancy. Just be fine. If I am pregnant, I am fine. If I am not pregnant, I am fine. So any female's worth is not measured by a pregnancy test. That is what I feel. There's much more to them.
Thank you so much, Dr. Mandvi. I really appreciate your time and the kind of structured answers you have given, and the piece of advice and word of wisdom basis on your experience will definitely help our audience, whoever is planning to take any decision with respect to having IVF or understanding more about their reproductive health. I request my audience, if you want to meet or get in consultation with Dr. Mandvi, in our podcast description section, we will share the links. You can definitely contact and get answers to whatever queries you have. Till then, thank you so much, ma'am, for
Thank
your
you.
time. And we will definitely try to get in touch with you again and do deep dive on some of other topics.
Right.
Thank you.
Okay, thank you.